implemented and be curative. In the majority of cases, we will have to live with our lung cancer. My father did not even have more than 6 months to use of the alcohol that basically put me in a position where I have alcohol withdrawal syndrome. So I couldn't go to work. I lost my job. My family lost their house. Those are the impact of alcoholism on our society. Look upon it, and as we highlight the diseases of our parents, etc., I am happy to say that my father was someone who never abused alcohol. He may have enjoyed a drink. As such, I gathered from him, I will never want and hopefully will never have to depend on alcohol. But I'm hoping that we all can look within our families and find that alcohol itself has that impact on us. But look upon the medical facts of what alcohol does to us and then make that decision that we don't need to get drunk in order to have a good time. We can have a drink and makes us feel good, we relax, we dance, we feel happy, we eat and we enjoy our life, because life is about enjoyment. When we drink alcohol, basically it's absorbed very rapidly. If we drink alcohol too rapidly, here's the implication. We drink, let's say, 2 ounces or 3 ounces of alcohol without a break in between. The alcohol itself is, when we drink it, it's absorbed in the stomach right away. It gets to the bloodstream. There's no fact of it going through the liver for metabolism if it's drank at such a fast rate. And usually the recommended dosage is that basically if we drink 2 ounces of alcohol after every hour, it can actually be metabolized. Two reasons for this. One, we will not get drunk. We will still feel the buzz, and it's the buzz you're looking for, not for the drunkenness associated with it. That's what relaxes you. That's what makes you feel you're having fun. The drunken state is what makes you feel you lose control, and that's when you start to behave like an idiot. That's when we lose control of our faculties. That's when we start to curse. That's when we start to behave inappropriately. That's when we start to dance with someone else's wife. That's when we understand that our behavior is unacceptable in terms of society norms. If you drink socially, let not do more than 1 glass of alcohol probably per hour. In that case, you will not also be able to detect alcohol levels high enough where you're pulled over for drunken driving. But the issue is not finding out your alcohol level is high, is the fact that it does impair your judgment. So you're putting the lives of those in your car at risk. You're putting the lives of those you're responsible for, and hopefully the ones you're carrying in your car are your loved ones, and you're the one because of your drunken state. And you'll find a lot of times, especially in our society, when we drink, we have more power. We feel as if we now need to be the one driving all the way home. Not only that, we can bad drive somebody because I think they bad drive us. Our judgment is so impaired that we make decisions that probably could be detrimental to, one, the lives of those we have in a car, our ability to continue driving, and then the number of times we spend in court and for rehabilitation thereafter. Not only is alcohol going to end up damaging the nervous system from chronic abuse, by causing diffuse brain damage, and we always notice in the case of a person who's a chronic alcoholic that the brain is much smaller than usual. The brain has lost a lot of the gray matter in it, and they also have evidence of increased lacuna infarcts in the brain that decreases the conduction within and decreases the process of thinking. We also know the increased incidence of gastritis associated with alcoholism, peptic ulcer disease as well. We also know from the fact of the damage to the liver basically makes it from a normal liver to a fatty liver, which is reversible once we stop drinking, then to alcoholic hepatitis, which is still reversible to fatty liver and then to a normal liver. But once we develop cirrhosis, we can wish our liver goodbye. And a lot of the cases I've seen in Richmond Hill for the chronic alcoholics, the end process of death is end-stage liver disease from cirrhosis. We can also develop portal hypertension from cirrhosis, forming esophageal varices within the esophagus, and these ruptures cause increasing hemorrhage and can actually cause death. Also, there's an increased risk of pancreatitis, which is a disease occurring in the pancreas and the digestive enzymes of the pancreas that cause an intractable pain that goes all the way to the back. The issue of that one intractable pain is there, but then you develop chronic pancreatitis, which is a recurrent, very disgusting disease process, and every time you take a drink, it causes an intractable pain, you're unable to work, and in fact your life is basically just one rotating around one drink and the pains, and that's how you go on forever. Also, in addition to that, we find that increased amount of heart disease based on the fact of the myocardial fibers undergo increasing in size and the contractility of them decreases. So the gamut of diseases related to heart disease, brain, the liver, and the stomach itself, it must make us realize that alcohol per se and the way we use it in our community is probably not healthy, and we should revert back to where it is working for us. For those of us who are young there and of reproductive age, alcohol also damages the reproductive organs. You'll find that the person who has drank will have decreased amount of testosterone being produced by the testes, and also in fact decreased libido, and also decreased sperm production as well. For the women who drink, and it's associated with smoking and drinking, you find that there's an increased risk of intrauterine growth retardation because of the decreased blood flow to the placenta. Alcoholism itself, as a means of relaxation, recommendable. As a means of abuse, highly unrecommendable. What is the impact of diabetes on our parents? What is the impact of diabetes, let's say, on our fathers at this particular time of the year, once we're celebrating Father's Day, Father's Month, etc.? What is it that makes this disease process so much more, so much more important for us? Because it's not only a disease process that is very common, and it's endemic in our population. 1 out of every 4 of us over the age of 50 is going to be diabetic, or is already diabetic. Out of those, our fathers account for approximately 50% of those affected. At this unique time of the year, when we're putting fathers into perspective, let's look and see the impact of diabetes on our fathers, and see what is it that we can learn about diabetes so that we can try and prevent the side effects and the complication of diabetes as children of those fathers who have diabetes. And as children also to understand what is it that our parents go through having had diabetes, and what are the end organ damages to diabetes, that we can better understand the disease and being able to be more empathetic to them as they try to go through life with a very serious illness. Hopefully us, having learned more about diabetes, are probably going to be able to control it much better, and also in addition to that, being able to control the end organ damage, which is what's going to result in our chronic renal failure, our blindness, our decreased vision before we get blind, our cataracts, our glaucoma, what is going to cause our premature heart disease with our high incidence of atherosclerotic heart disease that eventually will cause us to have stent, then a bypass. What is it that's going to cause us to go to early onset of end-stage renal disease that's going to result in us having dialysis? And for us to understand that dialysis is not a way of life, it's an end to a way of life, because it means 1 out of every 2 days belongs to you. The day you go for dialysis is not yours because you're tired and fatigued. The day before you go for dialysis is not even yours towards the end of the day. The only good day is the day after dialysis. So just imagine your world now has been decreased from rather a 24-hour window of opportunity to spend 12 hours awake and having fun. Every 48 hours, only 8 of those hours is spent with any degree of excitement and fun in your life. As a diabetic, you get up in the morning. Let's, for instance, say this is a diabetic. We basically understand that the most common form of diabetes that we have is type 2 diabetes. Type 2 diabetes because we have a relative insufficiency of insulin, either genetically programmed that our beta cells of the pancreas do not produce enough insulin. Then in addition to that, our foods that we take, which is this high carbohydrate diet, which we all swear by, that basically when it gets digested into the stomach after 2-3 hours, it is sugar water. The bread, the roti, the rice, it's the same thing. It becomes sugar water. It tastes good. I like it. But at the same time, the facts of the matter is it is sugar water. Whether or not you say I don't take soda, it is sugar water within or orange juice. It is vitamin C with sugar water. That basically, the minute you drink the juices, it becomes absorbed from the stomach, and then it's stored in the liver, and then it basically becomes fat. Or it can be utilized for energy. But most of us who are living sedentary lives do not have the reason for utilizing that amount of energy. In our days in the plantation and the sugar estates, we drink the water, we drink the juices, we eat the rice, we eat the roti, but we burn it out in a very short period of time as we do a tremendous amount of manual labor. Highly respected, good way of life. Yet in that case, there was not the high incidence of diabetes. What has caused diabetes to become endemic in us is the intermarriage that has occurred and the propensity for the propagation of the genes that produce the decreased insulin from our pancreas. The same factor that's playing out now in our increased incidence of coronary artery disease from high cholesterol by the propagation of the gene type 2 hypolipidemia B. That has basically caused our increased incidence of coronary artery disease. But as a diabetic, When the sugar is uncontrolled, your father gets up in the morning. He feels tired. He feels dizzy. He can slip and fall. He gets up to gets up off the bed. He feels staggered. He feels weak. Probably over the night, he would have had to get up about 2 to 3 times to go to the bathroom, either because the sugar levels were high. But the sugar levels are high, we pass urine frequently because it is osmotic diuretic. They pee a lot because of a simple fact, the sugar in the blood, and when it's filtered, it causes that. In addition to that, he's also going to have some form of prostate disease that's going to result in him not being able to retain as much urine in the urinary bladder itself. So from the sugar he gets up in the night to pass urine, the same time he gets up from the prostate disease as well, 3 to 4 times. There's not enough sleep at night. He gets up in the morning, feels tired and fatigued. The sugar level may be high, the pressure may be high, he feels weak and dizzy. Gets up enough just to go to the bathroom, may pee in the toilet seat. Everyone rebukes him for peeing on the toilet seat. He might forget to wipe it because of a simple fact, his mindset is not as clear and crystal like us when our sugar levels are normal. He might go to the bathroom, forget where he leaves his towel, and probably someone gets annoyed that he's leaving his stuff all over the place. He gets up in his weak and tired state and wants to go out to work, feels very tired, feels very fatigued, but yet gets up and goes there. All of this time, we don't even know what takes place in his mind as to how he feels. The tiredness, the fatigue, the lack of sleep in the night comes. But yeah, that same father is the one who goes out to the house. He gets on the staircase, is increasing shortness of breath, increasing tiredness, maybe forgets to take his medication. His sugar gets high, his blood pressure gets high. Then we burden them in addition with all the responsibilities they have to take. We also know that the simple fact is vision may not be as good as it used to be and probably overlooks a lot of things that happens in our diabetic parents, especially this time our diabetic fathers. He's been faced with the fact of erectile dysfunction at a much earlier age because of the sugar not being controlled. He's been impaired by the simple fact of decreased vision. He's been impaired by the simple fact of the increased incidence of coronary artery disease and the shortness of breath and tiredness and fatigue. He's been accused of not being as good a husband he is because he's not being able to fulfill his matrimonial commitment to his wife, and probably not being able to spend as much time with his kids doing the things because of his tiredness and fatigue. Those are all the impact as we see diabetes as it plays out in our society. At the same time, he gets the losing muscles, he feels less about himself, his face looks haggard, he is dehydrated, his face looks crenated, he looks much older than he is. There's premature graying, there's a factor of lack of self-esteem. Those are the facts. Those are the facts for us with diabetic parents. So next time you look at your diabetic father, it's not only the father who's actually been there for you all these years. It's a fact with a disease condition that basically makes it difficult to even live a normal life. Let us at least respect our parents, respect the disease processes, and learn as much as we can about these diseases so that we can better prepare ourselves for our lives ahead and learn from them as well. But let us at all times treat them with the utmost respect. Because remember, everything your child sees and the impact you have on your parents is exactly it's going to play out as you get older.